going to start with you, Irina, because I am fascinated about modern menopause management. Please expand. Please.
Yes. Hi. Thank you so much for inviting and thank you for having us here. So MMM, and not to be confused with M&M, which is very nice little chocolates that we all love, of course. MMM is a modern menopause management, and we like to call it Menostart because we do believe of self-reinvention and self-rediscovery at any age. And of course, at any stage. And menopause, it's one of those stages that we need to kind of rediscover ourselves yet again. So we generally take to educate our patients with first and foremost, prevention is better than cure. Why wait until the symptoms gets in our way and do quite a chaos with our life? Why not start addressing them very early, right at the very beginning of menopause, as we've talked about here already? The second kind of aspect of modern menopause management is to embrace that stage. So to be more optimistic, to be mindful of that stage and kind of embrace it with all your heart and take mindful steps towards that. Because menopause or premenopause, it's not just about hot flashes, it's also about our health span and lifespan. We live longer and longer, but the 20 years of our lives and a woman's life, we lead a little bit impaired life in comparison to men, for example. So why not address it earlier on in your perimenopause? So all in all, modern menopause management, it's really to celebrate us women who are going through the stage and who want to age gracefully and who want to age with confidence, also with zest for life. Why should we lose it later on? And also who want to age in a community of like-minded women who would support each other. And that's what we really promote in modern menopause management. And we understand you and we see you because we are you ultimately.
Thank you. Thank you very much for that. On that point, compared to men, women live 25% in disability of their life. Did I say that correctly? So 25% of women's lives is spent in disability, and this is according to McKinsey & Co. And that's one of the reasons why lifespan and health span, actually rather than lifespan, is more important. Thank you very much for this. Now, I have a question around peptides. What are they, Dr. Khalid?
Thank you for inviting me. So peptides, first I want to ask the audience. Anybody using peptide therapy? Raise your hand.
Real high, so we can see.
Not for cosmetic reasons.
I think we're about 5 or 6.
Okay, good. So actually peptide therapy, or that other is the peptide bioregulators. Well, first talk about the peptide therapy. So as you know, protein is more than 50 amino acids is considered protein. Less than 50 amino acids is considered as a peptide. And when you have peptides, amino acids around 2 to 4, this is peptide bioregulator. And the second thing, what are these? These are the building protein blocks of your human body. As we age, as we kids, we have enough protein. We take it from food and everything. So our tissue repair and regeneration is quite more quicker in the kids. But as we age, we have the ability to produce more proteins in our body, so that we have to take it from other sources. And our signals between the cells and tissues will all be reduced as we age. Therefore, we require peptide. And you go with the longevity, the hallmark of aging, they are about 12. And you can see the peptide therapy will be the number 13 coming on soon. It's trending right now, peptide therapy is used by celebrities, by sports people, and it has a lot of multiple functions in the body. It can enhance the muscle growth, fat reduction, better energy, better immunity, better focus, cognition will be better. There are multiple functions with minimal or now safety with no side effects. So It can be injections and it could be oral, but most people they use the injections. You don't use it for your life. And we go to the peptide bioregulators, which is a different form. This is tablets. And what does it do, the peptide bioregulators? It goes into the DNA of the cell and it switches the gene of your epigenetics. So everybody say has thyroid, hypothyroid or hyperthyroid, it will restore the balance of the thyroid back to normal and any organ.
Thank you for that, because hypothyroidism or hyper, depending on which way around, it could be one of the first symptoms of perimenopause. So thank you so much for bringing that up. Now I have a question for the wonderful Laura here. In terms of all of this information that we've heard today and what both Dr. Khalid and Irina mentioned, do you think women have enough information on this topic?
So thank you for having me in this amazing summit and such an essential topic that we are talking about today. To answer your question, absolutely not. And thank you for asking this question, because this is an important one, an essential one. And to answer it, I'm going to stand up. And the reason why I'm standing up is because I have a gift for you, and for everyone in this room. I'm going to share with you a personal story, and this is a story of my sister. She's 47, and she's going through burnout, a quite advanced one, actually. Toxic environment, huge exhaustion, fatigue, high anxiety. No one, and when I say no one, looked at her blood test until I asked her, show them to me. Her blood test was showing that she was into the middle of her perimenopause and her hormones were all over the place. So from the moment I told her and gave her this information, we worked on
Irina, when is a good time for women to start the MMM? Of the M&M.
To start MMM, yes. The best thing to start, we feel, as soon as possible. And there are quite a few reasons for that. There is a window of opportunity for any of us to start BHAT. We provide BHAT in our center. We also do peptide therapy, we also do peptide bioregulators, but we are talking about BHAT more now because it's the best time for a woman to optimize her level of estrogen in our body.
Right. So, did you say VHMTO?
BHAT.
Oh, BHRT.
So, bioidentical hormones.
Yes,
basically. Yes. Hormone therapy.
Yes.
The first 10 years is the best, and that's been concluded with that wonderful study of WHI, which didn't quite do a lot of good for generally for BHAT, for HAT, but it did do some good, and that is first 10 years in menopause. And we suggest that you ladies start even in perimenopause. The minute your symptoms come in, start your therapy, because it will help you not just with your symptoms. We know that we can rid of symptoms quite earlier on and quite quickly. Within 2-3 weeks, you won't feel them almost. But you will help yourselves with the whole aging process and live more active, more life full of zest for life, and live longer and enjoy life to the fullest.
Thank you. So you both mentioned peptide management. Dr. Khalid, your approach, you said that it affects 12 hormones that I understand. So is it the same peptide therapy for all women? Do you adapt it? How does it work?
So the peptides, we use it for women, okay? It could be perimenopause, menopause, or even early age, okay? And the peptides, there's a lot, 70,000 peptides. But they are more commonly used, the top ones, like BPC, CJC, these are the common ones. And it depends on the person's need and what they require. That's how we approach. It's good, it regulates the hormone balance. It prevents the osteoporosis and treats sarcopenia and better cognition function, better sleep.
So how do you know what peptide therapy to use for each woman? Sorry, I'm asking you that.
Most of the peptides cover has a lot of benefits. It's like one benefit. So my protocol is to use 1 or 2 peptides in the first 2 months, and then they have a break of 1 month so the body can adapt. And then they could switch to another 2 peptides with the different benefits. And then they have a break and then another third. So they have 3 cycles By the end of 3 cycles, they have already completed 6 types of peptides with different benefits, which include anti-aging. And then they can, after 6 months of that, they can choose whatever they want of the peptide. Now, very important is the foundation. If the foundation of the body is poor, like a bad lifestyle, nutrition, smoking, whatever, there's no point to take the peptide therapy.
Right. Excellent. So it needs to be a holistic approach as well, which is what you're talking about, Irina. Excellent. Thank you so much. And we've got 8 minutes left, and I have to be as harsh on myself as on the other panels. So since we've got very little time left, can we have a parting comment for all of you on what would you advise these amazing women here on what to do next? Can I start with
Ladies first.
ladies first? Okay.
So I would suggest if I should give you an advice from the standpoint of view of a woman who is going through a menopause myself, a 52-year-old, I would suggest start your hormone therapy as early as possible. As I mentioned last time, that would be my only suggestion. If I could go back, I would have done it for myself, and that's what I wish the same to all of you.
Thank you, Dr. Khaled.
So one is to do the GI gut microbiome test. That's very important because there's the root cause of all diseases in the future or whatever. Second, alternative, if you want, we do a biological age. The biological age is not about the body that suppose somebody is 53 and the biological age is 47 means that they are aging slowly, which is good. The risk of disease is low. But the new version, the biological age, identify the age of different organs in your body. I had a client who was 53, her age was 47, but was good. But checking the biological age of different organs, she was aging very quick in her brain, in her liver, and another in the eye. In this way, I can target the therapy I want in order to reverse this.
So are you the future of medicine then, by the looks of things?
is with us.
Wow, this is an eye-opener. Thank you very much. Noor and then Tamara, parting comment. Noor.
So my advice is, again, knowledge is power. Know where you are with your hormones. Do your blood test. Embrace your hormones and think of yourself.
Merci bien. Over to you, Tamara.
I think for me personally, it's just talk about what you're feeling with people. A lot of people come into clinic and they're saying, oh, my husband doesn't understand me. He doesn't really get what's changing with me. I don't feel the same. But the more that we share with our kids, whatever age, we talk about periods when our daughters turn 14, but we don't ever tell them about perimenopause or menopause or lactational atrophy or anything. You kind of just have to have a stab in the dark and try and learn it yourself. So if we as a community of women and men, I can see there's men in the crowd, which is great, talk about it a bit more honestly, then it's less painful to go through. Even if you don't want to have hormone replacement, the most important thing is sharing your wealth of knowledge. And the last thing I wanted to say is about libido, because no one really talks about this and everyone seems to be a bit embarrassed. But one of the most common symptoms that I see in clinic is libido changes. We should be able to talk about it openly and honestly, maybe not in public screaming in the Museum of the Future, but amongst our friends and our spouses at least. Someone's clapping, thank you. But I just think the more that you open discussion with people, you realize you're not alone with what you're feeling.
Thank you. Thank you. We do have a session, very interesting session around this whole topic of intimacy, desire, etc. So we have time for one question. Is there, oh gosh, there's a lot of questions. There's going to have to be one. If we can get in two, we will. But if, can my beautiful assistant,
Yeah, we have
Yes.
we have peptide for libido.
that was it. That was, how do you follow that?
You can ask the question that are you working together? Huh?
Right. Okay, we have probably time for one question. Who's got in there quick? Oh, very, very, very passionate lady back there. It may only be one question because I've got exactly 3 minutes.
Hello, everyone. My name is Hala Zahruddin. I'm a geneticist and molecular biologist. And thank you all for the very well-organized meeting and beautiful talks and for the very interesting panels. I'm really so happy that these topics were covered. And you've talked about precision medicine, which is predictive, preventive, personalized, and participatory, and this is important. And I would like to talk about the predictive and the importance that the doctors, the family doctors and others would look at the family history. What happened to your mother? Do you have breast cancer in the family? What is your risk of breast cancer? And get genetically tested for it. There is a panel of 120 genes that can be sequenced by whole genome sequencing to identify any breast cancer or ovarian cancer mutations. And based on that, and based on your family history, you will still be able to enjoy hormone replacement therapy, but it should be personalized to you and only you, and the decision would be shared between you and your healthcare provider.
Thank you. Is there a question in that? No.
So I would like to ask about the genetic testing.
Thank you. Genetic testing. Sorry, very short on time.
Yeah, what's your question about genetic testing?
When a patient suffering from perimenopause and menopause, and before giving her the advice of going to hormone therapy, knowing that there are risks that are associated with certain types of cancer that are estrogen responsive cancers.
So, are there any genetic tests?
Yes, there are. Yeah, there's genetic tests. There are different types.
And so, okay. All right. So,
The point is that not every client wants to do it.
So, would you recommend
it's not mandatory, but in the future it should be mandatory.
Right, so you would recommend it, because that's an interesting interception there. You would recommend it.
Yes, I recommend. I recommend for everyone to do at least a cancer disease for risk.
Is that if it's in the family, irrespective of whether it's in the family or not?
Depending on
Irrespective.
Can I, excuse me, we're the panelists.
Yeah, irrespective. The reason why, the gene which carries in the mitochondria can carry for 70 generations.
How many?
70 generations.
Okay, so I think this is our parting comment. Going into the 70 generations. I find this fascinating. Thank you, Dr. Hamid. Thank you, Irina. Thank you so much, Tamara. And thank you, Laura, last but not least. This was fabulous. We could have gone on for a lot longer, but I do have to be very, very strict in myself as well. So thank you very, very much. And please do stay around and ask more questions, because this has been highly eye-opening.